members who have other committees, and we're going to be running between committees. So we are going to go ahead and call this meeting to order. This is the fifth meeting of the House Standing Committee on Health Services. And I'd like to go ahead and call the meeting to order. And DJ, please take the roll.
Representative Bentley. Here. Representative Bratcher.
Here.
Representative Bray. Representative Burke. Representative Callaway.
Here.
Representative Dotson. Here. Representative Duval.
Here.
Representative Frazier Gordon. Here. Representative Justice.
Here.
Representative Neighbors.
Here.
Representative Rayburn. Representative Raymer.
Here.
Representative Riley. Representative Rourks.
Here.
Representative Sharp. Representative Swan.
Here.
Representative Weber. Representative Wilner.
Here.
Representative Whitten.
Here.
And Chair Mosier.
I'm here. Okay, we have a quorum established to do business, and we are going to go right ahead. I would like to take a moment to thank our friends from Special Olympics for being with us today. If you could please stand and be recognized, and I just really want to say I appreciate all of your work. Thank you so much. Okay, first we are going to take up House Bill 176. We have Representative Nemes, and please, if you have any guests, have them introduce themselves for the record, and you do the same.
Thank
Please
you, Madam
proceed.
Chairwoman. I'm Jason Nemes, representative of the 33rd District, which is Jefferson, Oldham, and Shelby counties. And I do have someone with me on Zoom. April, you want to identify yourself?
Yeah, hi, I'm April Hester. I am a nurse anesthetist representing the Kentucky Nurses Association today.
Thank you so much for being here. I know that you've stepped out of surgery actually to be with us, so thank you.
Yes, thank you for understanding.
We do have a committee sub. I'd like to entertain a motion on the sub. Motion. Do we have a second? Second. All in favor of adopting the sub? Aye. Any opposed? Okay. Please proceed.
Thank you, Madam Chairwoman. I'm going to say just a few brief remarks and then hand it over to somebody who actually knows what she's talking about, a whole lot more than me anyway. I want to say the Kentucky Nurses Association brought this bill to my attention in order to prevent violence or help prevent violence in healthcare settings and to protect our workers. 48% of nurses report an increase in workplace violence. 63% of medical providers report injuries from violent attacks. Healthcare workers are 5 times more likely to experience workforce violence than any other industry. And 39 states have enacted some forms of workplace violent prevention legislation, and now it's our turn in the Commonwealth to do the same. Ms. Hester is going to talk about the bill and other aspects, other issues, and we'll take questions.
First and foremost, I would just like to thank everyone for their time and attention today and allowing me to Zoom in from work. I really, really appreciate that. Like Representative Moser said, I'm taking a quick lunch break to step out and talk to you guys today about something that can affect every healthcare worker within our state. A little background on the Kentucky Nurses Association. It was established in 1906, and we represent 90,000 nurses within the Commonwealth. Each of those nurses within the state are represented regardless of their specialty or their fields within nursing, and there are 80 different practice types within this state alone. Nurses comprise nationally of 53.3% of the entire healthcare workforce, and there are 4.4 million nurses within the United States. Like all other healthcare professions, the need for nurses is great. It's very important to focus on the retention of nurses in the current work field. One way of ensuring retainability is to harbor a safe workplace by implementing a workforce violence prevention program. Safety within the workplace is essential for the retention of nurses within this state.
Motion on the bill.
We have a motion and a second. Do we have any questions from the committee? All right, seeing none, DJ, please take the roll.
Representative Bentley. Yes. Representative Bratcher.
Yes.
Representative Bray. Representative Burke. Representative Callaway,
Yes.
Representative Dotson,
Aye.
Representative Duval,
Yes.
Representative Frazier Gordon,
Yes.
Representative Justice,
Yes.
Representative Neighbors,
Yes.
Representative Rayburn, Representative Raymer,
Yes.
Representative Riley, Representative Rourks,
Yes.
Representative Sharp, Representative Swan,
Yes.
Representative Weber, Representative Wilner,
Yes.
Representative Whidden,
Yes.
Chair Mosier.
Yes. Okay. House Bill 176, as amended by the committee sub, passes with favorable expression. The same should pass. Thank you. I appreciate this bill very much and the work that you've put into it. And thank you for stepping out and being with us today. I appreciate it.
Thank you for allowing it.
Of course.
Thank you,
All right.
Madam Chairwoman.
Thank you. Okay, next we are going to hear from Representative McPherson on House Bill 101. And if you could just introduce yourself for the record, and I don't know if you have any guests with you. Yes, and if we have any members who would like to register a vote on House Bill 176 as amended by the committee sub, please do so now.
I'd like to register a yes vote and a present.
I would like to register a yes vote and a present.
Okay, thank you. Please proceed.
Thank you, Chairwoman, and members today. So this is House Bill 101. It does have a committee sub with it, so.
Okay, we have a committee sub. We have a motion on the sub. Do we have a second? All in favor of adopting the sub? Any opposed? Okay, thank you.
Okay, thank you. I'll explain the sub. The sub just explains in more detail. It said notwithstanding, and it gives a group of KRS laws that no person's entity or corporation or government agency should or shall require a child to receive a COVID shot. Now, this doesn't mean that a parent, guardian, anybody else that has the responsibility of that child does not, if they want them to have a COVID shot, that's fine. That's not what this bill is about. This bill is basically about the CDC recommended that COVID shots become more like flu shots. And what my fear is if we don't decide that the parent or guardian is the one responsible for these children to receive COVID shots, then possibly when we get out of session, the KDE could recommend, based on the CDC recommendations, that before kids go back to school next fall, they have to have a COVID shot. That's the premise of this bill.
All right, thank you. Do we have any questions from the committee? I think it's pretty clear. This is just K through 12, no mandate for COVID only. Okay, we have a motion on the bill. We have a second. Okay. Any further discussion? All right, hearing none. DJ, please take the roll. Oh, I'm sorry. Yeah. Oh, yes.
Thank you. Before we voted, I just wanted to record that I will be a no vote today. As you can appreciate, I believe that in our public settings, it's of utmost important for us to ensure that folks are vaccinated for public health reasons. And I'm respectfully, understand that we just have a disagreement of opinion here. But I think that, for a long time, in terms of public settings and public schools, we've required vaccinations, and there are alternatives if a family member does not wish to vaccinate. That's why we have homeschool. And I think in our public settings, we have a social responsibility to ensure that we are vaccinating against, diseases of various diseases, viruses, and that's why I'll be voting no today.
Okay, thank you, Representative Vork. And this in no way diminishes the value of vaccines. This just gives parents a choice in K through 12 only for this specific vaccine. And this is being treated much like the flu vaccine, where the variant is different every season. And so that's why we felt like it was important to give parents a choice and not mandate this. So any other discussion? Okay, seeing none. DJ, please take the roll.
Representative Bentley, Representative Bratcher, Representative Bray,
Yes.
Representative Burke, Representative Callaway,
Yes.
Representative Dotson,
Yes.
Representative Duval,
Yes.
Representative Frazier Gordon,
Yes.
Representative Justice,
Yes.
Representative Neighbors,
Yes.
Representative Rayburn, Representative Raymer,
Yes.
Representative Riley,
Yes.
Representative Rourks,
No.
Representative Sharp,
Aye.
Representative Swan,
No.
Representative Weber, Representative Wilner,
No.
Representative Whitten,
Yes.
Chair Mosier.
Yes. Okay, House Bill 101 as amended by the committee sub passes with favorable expression, 14-3, and the same should pass on the House. Thank you for your work.
you, Chairwoman
and your
Mosier, and thank-
testimony. Of course, thank you. Okay, I am going to hand over the gavel to my vice chair at this time and run over and participate in the judiciary meeting. And I am leaving you in excellent hands. We have several bills that he will help us take up, and I'll be back as soon as I can.
Okay. Next bill we will hear today is House Bill 156 with Representative Dossett. If you would, make your way forward with any testimony that you have with you today. If you don't mind, go ahead and state your name for the record and begin.
Absolutely. Representative Myron Dossett, 9th District. Thank you, Mr. Chair and ladies and gentlemen. 2 years ago, we passed legislation to allow for essential caregivers in our nursing home hospitals to allow family members to be able to visit loved ones that may be in one of these type of facilities. In doing so, we forgot psychiatric facilities that would treat as well, private psychiatric facilities. We did include the state-run, but House Bill 156 will guarantee that essential caregivers will go into these type of psychiatric treatment centers which handle children from the age to 4 to 21. I've had 2 young people that have families have reached out to me over the last 3 months that their children were taken to these, placed in for 72 hours. They're under COVID lockdown and no ability for any family member to see that child. So,
Okay. We do have a motion on the bill.
absolutely.
We do have a motion and a second. Do we have any discussion before we take a vote? Seeing none, clerk call the roll.
Representative Bentley,
Yes.
Representative Bratcher,
Yes.
Representative Bray,
Yes.
Representative Burke, Representative Callaway,
Yes.
Representative Dotson,
Yes.
Representative Duval,
Yes.
Representative Frazier Gordon,
Yes.
Representative Justice,
Yes.
Representative Neighbors,
Yes.
Representative Rayburn, Representative Raymer,
Yes.
Representative Riley, Representative Rourks,
Yes.
Representative Sharp,
Aye.
Representative Swan,
Yes.
Representative Weber, Representative Wilner,
Yes.
Representative Whitten,
Yes.
Chair Mosier.
Okay, we have 17 yeses, no zeros. It does pass with favorable expression. Same shall pass on the House floor. Thank you.
Thank you. Thank you, Mr. Chairman. Thank you, committee members.
Okay, next we're going to have House Bill 196 with Representative Ken Fleming. There he is. I was looking for you behind the pole there. If you would, just state your names for the record, and then you can begin your testimony.
Thank you, Chairman. Appreciate it. I'm Ken Fleming, represent the 48th District, which includes part of Jefferson and Oldham County.
Good morning. I'm Liz McCune. I am a licensed psychologist and Chief Operations Officer and Vice President at U of L Health Peace Hospital.
You also have someone on Zoom, correct?
I do not.
You do not? Okay. We do have a committee sub.
We do.
Okay. I'd like to take a motion on the sub. Second. All in favor? All opposed? Okay, committee sub, Pat.
Great. Thank you, Mr. Chairman. Thank you, ladies and gentlemen, the Family Health Services. The committee sub was very, very simple. It actually just inserted a couple words, so it's not monumental. It's just more of a clarification between University of Louisville and U of L Health. So that's basically all it is. But let me go and talk about the bill itself. A couple of years ago, or actually about a year and a half ago, I was reading an article in the Wall Street Journal, and toward the end of the article, it basically talked about an app that goes on phone devices whereby middle school and high schoolers can access mental health professional 24 hours a day, 7 days a week for crisis intervention. Since that time, I have worked with several legislators in University of Utah. I'm not University of Utah, but State Utah, the General Assembly members, as well as U of L Health. And I just want to put a plug about U of L Health. They've jumped in at the very beginning to help cultivate and get this to where it is today. And this is really a dynamic and I think a pretty much of a needle mover when it comes to helping our kids out when they come across a very significant crisis situation. What this bill does, which is 196, it establishes the Kentucky Health Safety Center, which is basically called Safe KY, Safe Kentucky. And it basically is off of the Safe UT or Safe Utah. In addition, it creates an advisory board to guide, counsel, and provide a resource for U of L Health. These members basically come across from a wide spectrum of disciplines, and basically those members of those council is outlined in the bill. It enables Safe KY to create, implement, and maintain an app for middle and high schoolers, college students to access mental health professionals to help divert crisis and provide some guidance. It also has a good reporting requirements so when they can come back and show us how things are being successful and so forth. But their ultimate goal is to go through a pilot project for this coming year or this year and then implement this throughout the state. We do have a couple of schools that are interested in this. And then U of L Health will basically cultivate those relationships as well as law enforcement to help those things out. So I'm going to have Liz sort of give a little more detail about the Safe Kentucky.
So thank you, Representative Fleming. Safe KY will be an app that is loaded onto a phone, and through that app, an individual, whether that's a student, whether that's a parent, whether that is a school official, will be able to text anytime they have an emergency concern that may involve mental health. If they become aware that a student may be aware that there's a weapon on campus, or if they are having thoughts of self-harm or harming others, they can send a text. We know with our youth that text is the preferred form of communication, and currently 89% of teens carry a cell phone. So this would be an opportunity for them to reach out. We would have a licensed person on the other end of the text. They can reach out anonymously. We would then connect them with either law enforcement or school officials or a trusted adult, maybe a parent or other adults, so that they can then help in resolving the crisis situation. This is meant to be an extension of school personnel and an extension of emergency services in getting these kids connected in order to prevent any major catastrophic event. Currently, the Safe UT program that we have been working with handles about 32,000 inquiries a year in which they have worked to reduce acts of suicide as well as become aware of weapons and hopefully prevented any catastrophic events.
I also want to add, Mr. Chairman, that this basically complements 911 or 988, I should say. Basically, sometimes it's hard to remember a number. All the student does is they're basically face plant in this thing right here, and they basically have this app right there in front of them where they can go and access a mental health professional. So that's really a really good benefit, and once again, it complements the 988. The other thing I want to mention.
We have a motion on the bill. You want to finish your thought? Go ahead.
Yeah, if you don't mind.
Go ahead.
Because I think this is really a monumental thing that you're voting on today, because a lot of these calls come in between 11 p.m. and 3 a.m. And sometimes, you know, we're parents and we're sleeping, and so they will call this app, make sure that things are taken care of, and so they address the student and their needs and so forth. So, so I just want to make sure that this is a monumental thing that you're voting for, and I think it's going to be very implemental and very important for the life of our kids.
I do have a quick question, and you answered it in part. Going back to the 988, how does that interface with the app itself? How does that correlate together?
So we've talked with some of the 988 representatives in the state. We currently have 10 different call centers that answer 988 calls. Only 1 or 2 of them at this point are able to take texts. And since this is designed as a primarily text and chat feature, it's meant for us to become aware of that, and then we can also loop in the 988 or 911 services if needed.
Gotcha. Thank
So
you.
it's meant to work in conjunction.
Thank you. I do have a couple questions. Representative Bentley?
Thank you, Mr. Chairman. I want to compliment the U of L Health for putting the money forward to do this. I ran the same bill 5 years ago and couldn't find any money. And the president of the Senate in Utah is a good friend of mine, so I hope y'all do a good job. Thank you.
Thank you. I'd have another question here. Representative Winton?
Thank you, Mr. Chairman. You all talked about the anonymous nature of it, and I think that that's important. Can you speak a little bit about how they can be assured of the anonymity?
Sure. We do not collect any information at all when answering the phone, nor do you have to put in information to register for the app. If we became aware that someone had threatened harm on others, we can pass along the IP information to law enforcement, and they can then, through their channels, try to discover if it is a privately owned phone, where it may be coming from. But otherwise, there is no, it ensures anonymity, and I think that's part of the appeal and why students feel comfortable in reaching out.
Thank you.
Mm-hmm.
Any other questions? Okay. Clerk, call the roll.
Representative Bentley?
Yes.
Representative Bratcher?
Yes.
Representative Bray?
Yes.
Representative Burke? Representative Callaway?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon?
Yes.
Representative Justice?
Yes.
Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley? Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Swan?
Yes.
Representative Weber? Representative Wilner?
Yes.
Representative Whitten?
Yes.
Chair Mosier?
Looks like we have 16 yeses, 0 no votes, and House Bill 196, as amended by House Committee Sub, passed with favorable expression. The same shall pass on the House floor.
Thank you, Chairman, and thank you, ladies and
Great
gentlemen,
bill.
for a
Thank
historic
you.
moment.
Okay, now we're going to be calling House Bill 311 with Representative Rebecca Raymer. You have any guests with you? Okay. If you would, Representative, make your way to the table and give us your name for the record, and also your the name of your guest on Zoom.
I'm Rebecca Raymer, representative for the 15th District, and I believe I have Claudia Tucker, who's with Teladoc via Zoom.
Good morning. This is Claudia Tucker. I'm here.
And I think we do have a committee sub.
Do have a motion and a second on the sub. All in favor say aye. All opposed? Sub does pass.
Okay, so House Bill 311 is really a technical fix. It is going to clarify that in order for somebody to be a Medicaid provider, they do not have to be physically located within the state. They still have to be licensed. They still have to have a Medicaid.
We have a motion and a second. Would your guests like to share? I hate for them to take their time and not be able to say something, so.
Thank you, sir, members of the committee. I'm just here as a subject matter expert. Should the committee have any questions. This is really a cleanup bill, and it will go a long way to improving access for the Medicaid patients there in the state.
Thank you so much. Okay, clerk, take the roll.
Representative Bentley. Representative Bratcher. Representative Bray.
Yes.
Representative Burke. Representative Callaway.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon.
Yes.
Representative Justice.
Yes.
Representative Neighbors.
Yes.
Representative Rayburn. Representative Raymer.
Yes.
Representative Riley.